Good afternoon, everyone. Today's topic is anti-epileptic drugs, and epilepsy is a chronic disease that is very common, and every of person will have at least one epileptic episodes in their life. That doesn't mean that it requires treatment, but there may be one time. So if the episodes will return frequently, that may require treatment. Um, the reason of the development of the seizures is not yet completely understood, but there may be some abnormality in the brain that will trigger the epileptic episode. Seizures are divided to two types of focal that are further divided to simple and complex. Simple focal will only um, spread, show with the one group of the muscle. Complex may involve several groups of the muscles. Then the second type is generalized, and generalized is usually more continuous and with a loss of the consciousness, while focal are usually without loss of consciousness and disappear fast. Generalized seizures later are divided to tonic-clonic, absence syndrome, myoclonic, atonic, clonic, and tonic. So there are other six subtypes of the generalized seizures. And also, sometimes these episodes will continuously run one after each other, and that means this is a status epilepticus and requires prompt treatment. Other types of the epilepsy, rather than the status epilepticus, will not require uh, prompt treatment and will self-resolve. Usually, after the epilepsy uh, episode, the patient is very tired and may even fall asleep. Um, During the epileptic episode, the help may be required to catch the person who lost the consciousness and make sure that he will not damage anyone around, including yourself, and also make sure that uh, the person will not be immobilized too much, because excessive immobilization can lead to the damage to the soft tissues. So if you look at the classification of the anti-epileptic drugs, there are different mechanisms of actions, and we will start from the sodium channel blockers, and the primary drug for the treatment of the epilepsy is valproic acid and sodium valproate. This is the golden standard for the treatment of the epilepsy. And also this group includes phenytoin, that is most commonly used drug for the treatment, and topiramate and carbamazepine. Oxcarbamazepine is long-acting type of the carbamazepine, the derivative of carbamazepine, and lamotrigine is rarely used, but mostly in children and pregnant women, because other drugs are mostly contraindicated during pregnancy. And also, zonisamide is the thing. The Some of these drugs have multiple mechanisms of actions, and the for example, valproic acid has multiple, like also sodium blocking channels and NMDA channels. So, and that is common for most of the anti-epileptic drugs. So the next group is calcium channel blockers. This includes gabapentin, pregabalin, and also topiramate and lamotrigine. The latter one, two latter one have a multiple mechanisms of action, and um, then the next group is benzodiazepines. Benzodiazepines, we studied them last time, are also anxiolytic and hypnotic, as well as barbiturates. So, but also they have anti-epileptic activity that mostly include clonazepam, diazepam for the benzodiazepines, and phenobarbital for the barbiturates. The mechanism of action of these drugs is increasing affinity of the gamma aminobutyric acid for the GAM receptor. Then we have levetiracetam that are inhibiting the release of the glutamate, glutamate messenger, and felbamate is the antagonist of NMDA receptors, and also zonisamide and is antagonist of the calcium channels, calcium channel blocker. That is T-type of the calcium channel, and the same, and it shares the mechanism of action with the valproic acid that is primarily sodium channel blocker, but also is a calcium channel blocker. So like valproic acid has the multiple, all of the mechanisms of action, almost all of the mechanisms of action are available for the anti-epileptic drug, and that is why it's one of the universal anti-epileptic drugs available at the moment. Then we also have tiagabine and vigabatrin. So these are GABA T blockers, and that will prevent the release of the GABA from the neural junction. And I think that is all. Yes. So the selection of the drug is usually based on adverse effects and the type of the epilepsy, because some types of the epileptic patients will respond better to one of the group, and usually the common drugs to start the treatment are phenytoin and valproic acid. However, the phenytoin has many adverse effects, so treatment, even uh, phenytoin is the cheapest drug for the treatment of the epilepsy. The treatment of the adverse effects can increase the cost of the therapy. So side effects include for carbamazepine and oxcarbamazepine are decrease in the sodium levels. Valproic acid is increase in the weight. Gabapentin and pregabalin swallowing of the legs and extremities. Vigabatrin, the vision uh, vision diseases. Lamotrigine and phenytoin give gingival hyperplasia uh, and vision disturbances, and also the hair grow on the facial hair grow. For the valproic acid, it is liver toxicity and bone marrow diseases. Topiramate and zonisamide are decrease in the weight, and also most common side effects are with benzodiazepines and phenobarbital, that is barbiturates, are the sleepiness during the day, and also headache and uh, vertigo. So these are the most commonly seen side effects. Also, please keep in mind that the most of these drugs are contraindicated in pregnant women, and that is why epileptic women that plan pregnancy should be switched to the safe drug or before the planning the pregnancy. And if those drugs that are contraindicated during the pregnancy are prescribed, then the for women with childbirth potential, contraceptive should be also prescribed simultaneously. For example, the valproic acid that is most commonly used drug for the treatment of the epilepsy will lead to the low IQ in the children at the age of from 4. That is can be seen at the age of 4. And for the valproic acid, divalproics, that is a long-acting combination of the sodium valproate and valproic acid is available, and that increases the also GI tolerance of the drug, and also the drug is teratogenic, so that is why contraindicated in pregnant women. Other drugs that are contraindicated are phenytoin, phenobarbital, topiramate, oxcarbazepine, and carbamazepine. So, and so particularly the valproic acid and phenobarbital should be avoided during the pregnancy. For the status epilepticus, usually intravenous injection is required because it's life-threatening condition. and usually diazepam is injected intravenously, followed by the phenytoin, because benzodiazepines, including diazepam, have a fast onset of action. Um, there are also some symptoms that include the epilepsy, that is Lennox-Gastaut syndrome, that is seen in newborns and requires administration more than one anti-epileptic drug. In that case, usually valproic acid is combined with with a phenytoin or some other anti-epileptic drug, and also some sleeping agent and anxiolytics should usually prescribe as well. Um, Thank you for your attention, and that is all for today. See you next week.